Hello, my name is Bill Webb, and I'm the Executive Director of the Congressional Fire Services Institute, and I'm serving today as the moderator for today's panel discussion. We're going to be discussing COVID-19. It's going to be an update on assessing the current situation and planning ahead for our nation's fire service as we deal with this pandemic. So let me start by framing the issue. We've got three great panelists who are here to discuss the perspective of each of their organizations on how they're going about addressing the pandemic for our nation's firefighters, career volunteer chiefs. And so we look forward to a very engaging discussion with these three panel members. For the past year, the Fire and Emergency Services have been on the front lines of COVID-19 pandemic. During this challenging time, fire departments have worked with local, state, and federal partners to respond to emergency calls involving COVID-19 patients and transporting individuals affected by the pandemic. Our three panel members will offer their assessments on the collaborative efforts between local, state, and federal partners to date in responding to COVID-19 and to discuss the future needs of the Fire and Emergency Services personnel to ensure that they are supported and get the equipment they need to perform their job safely and effectively. Again, we've got three great panelists, all nationally renowned. First off will be Chief Gary Ludwig, who is the current fire chief of Champaign, Illinois Fire Department, and served as is the immediate past president and chairman of the board of the International Association of Fire Chiefs. Dave Lang is the assistant to the general president for governmental affairs and public policy for the International Association of Firefighters. And Tom Miller with the National Volunteer Fire Council. He chairs the NVFC's Hazardous Materials Response Committee in its pandemic task group. So welcome panel members, and again, thank you for participating in today's discussion. Let's get started with the questions. Your three organizations represent fire and emergency services personnel serving on the front lines of the pandemic. They are the first responders providing on-scene care and transport of COVID patients. Thinking back to where we were at the beginning of the pandemic, can you assess the preparedness of the fire and emergency services in the initial stages of the pandemic, as well as the preparedness of our federal partners? So Chief Ludwig, I'll start with you.
Well, thank you, Bill. I appreciate the opportunity to be here today and talk about this so important topic. Yes, some departments were prepared, but there is no doubt the majority of the departments were not prepared. And the early stages of this pandemic saw us fighting for PPE to make sure our first line people who are on the tip of the spear, as I like to say, were protected. But it was a challenge. What was in the strategic national stockpile was going to the states, and the states were deciding what those priorities were. And so we found fire chiefs who were buying ponchos, rain gear, other types of things to try to protect their personnel instead of what would be standardized N95s and other types of barrier material. And so it was truly a challenge. There's no other way to describe it for our people at the tip of the spear out there.
Federal response in the initial stages, Chief, do you feel that they were unprepared or adequately prepared or somewhere in between?
I do not think they were prepared at all. The strategic national stockpile seemed to really have focused on sarin attacks and nerve attacks and other things of that nature. This was of all credibility, this was a unseen pandemic that was coming, but we knew that eventually PPE would be needed at some point, no matter what the event that was going to occur. I think the supply chain issues are a big issue. When we're relying on companies in another country to produce our PPE, that's part of the challenge. We would never rely on countries to produce our bullets or our tanks or our fighter jets if we were ever in a war. And this was a war with an unknown, an unseen virus. And we were relying on other countries for that supply chain. So this government, this federal government was unprepared. And they need to probably look at how can we manufacture these types of things inside our own shores.
Tom?
I agree wholeheartedly with what the fire chief said. The other issue that I saw that was truly outstanding, it was the first time in modern history where emergency services were in direct competition with the private sector across the country for items like PPE, gloves, masks, goggles, eye protection. So FEMA, which is generally prepared for regional emergencies, and they had divided the country into regions 1, 2, 3, through whatever, for the first time, there was a huge hit across the country on the strategic national stockpile, and it was quickly depleted in less than 10 days. There was also a lack of cohesion on the federal government side with release of resources that were in the stockpile. There were different states were applying it in different manners and had different priorities. There was a lot of work done in 2007 through 2009 on pandemic response, but there were never any true resources committed to it, especially to the major urban areas and the suburban areas that fed those, that where there was commuter traffic in and out of those urban areas to the suburban areas. And I think that was where the ball got dropped. Everybody planned for it. We knew there was a potential with it. They based a lot of models on the 1917, 1918 Spanish flu and then the avian flu, but they failed to, it was a great plan, but there were no resources committed to implementing the plan, which left emergency services, both fire, EMS, and even law enforcement behind the 8-ball.
Yeah. Tom or Dave, you and I have had a lot of discussions on this issue from the IFF perspective.
Yeah, Bill, thanks. I think the two previous speakers really hit a lot of really valid points. I want to leave everybody with the following thoughts. The fire service does a really good job at regional events. You get a hurricane, a tornado, a wildfire. I mean, look, we have the communication system, the incident command systems, and the resources to collectively work together to handle those emergencies. But in this case, we had a 50-state emergency. A 50-state emergency was something that we couldn't see. It was like a airborne hazardous materials incident. The fact of the matter is the response from the federal government not only failed our country, but it failed us. On the first responders that were going to this call every single day. And it starts all the way back in Washington State with that first nursing home call. The federal government really took an approach of a humanitarian, not a humanitarian response, but a commercialized response. We saw that in the stockpile in the supply chain, in which they wanted you to purchase materials from different companies, as opposed to maximizing that stockpile, the national stockpile, and being prepared to distribute that equipment that we need. There's also, we've done a really good job in the fire service to rising to the challenge for all things. First it was fire suppression, then it was EMS, then hazardous materials, technical rescue, high angle rescue, you name it, you call us, we deal with it. The problem is the federal government, when it views us, doesn't understand us. And on a federal response, they don't talk to us. There's no recognition that we're part of the public health system. So why the competition between hospitals and fire and EMS? They don't see us. They don't talk to us.
Yeah, you know, and one of the discussions you and I had was regarding the statements that were being issued from the Federal Emergency Management Agency, where they basically said, you know, first responders, fire, law enforcement, reuse your PPE, reuse your mask so you can make it, so we can save more for public health. And so in my opinion, there's that lack of understanding within some elements of the federal government that don't understand that the fire service is a part of that public health network. In fact, it's the initial response to any public health crisis. And, you know, I don't know if any of you would like to elaborate on that, but that's kind of one of the initial things that I noticed with how the government was dealing with it at the federal level.
One of the
Oh, go ahead. I just go ahead, Tom. But I go ahead, and I want to make a thought that after you get done.
One of the things that I found frustrating on the volunteer level was that there was a lot of emphasis put on the response of the National Guard and other entities with regard to the response, and it was almost a discounting of the role that the fire service plays in communities and in the response continuum. As Dave so eloquently pointed out, and he's 100% spot on, is they didn't recognize fire and EMS's role in the continuum of care. And we were kind of brought in to do, disinfectant and decontamination type roles. And there was this huge emphasis put on the National Guard, which they had a role to play in this. And I am very grateful for many of their resources. But in the initial phases, there was kind of a minimization or a discounting of the role that the fire and EMS service plays, both in urban and suburban areas and rural areas. So I want to point out, I think there was a lack of coordination on a federal level. There was a lack of guidance on PPE. There were conflicting statements coming out of different agencies and different entities. There was a tendency at the beginning to minimize it and they didn't realize as the wave swept across the nation that first responders were going to have to be a part of the front line. Even though they were used in Katrina, to help with tetanus vaccines and other things and set up vaccination clinics, it was in some cases, from talking to people across the membership of the NVFC, we heard that there was kind of like the involving fire and EMS was kind of an afterthought. And it's kind of like in some cases, some people felt they were the Mikeys of the COVID response. Hey, give it to Mikey because nobody else wants it. And they didn't realize that they've been dealing with it from day one.
Dave, Chief?
I was just going to expand on what Dave said and on your question, Bill. And that is, most fire departments are nothing. Our federal officials and decision makers need to realize that most fire departments, as we say, is nothing but an EMS agency that sometimes goes to a fire call. And we pump more oxygen than we do water. And the reality is that the fire service is the largest provider of emergency medical services in the United States of America. And we transported approximately 36 million patients to hospitals last year. We are a part of what Dave said, the healthcare system. And when we saw early days of the pandemic where the TVs focused on all the wonderful work that the nurses and the doctors were doing in the hospitals and the emergency rooms, one of the things I kept emphasizing when I was talking to federal officials is, how do you think those people got there? They didn't walk there. They didn't get in their cars and drive there. They were pretty sick and they got taken there by ambulances. And chances were they got taken there by firefighters in a fire department ambulance. So even though we have the word fire department in our vernacular, the reality is that we are an integral part of the healthcare system. And I would hope that our federal officials and decision makers realize that more.
Dave, you have a comment?
The chief brought up a valid point about pre-hospital. I mean, when we come and we start talking about prioritization for PPE, prioritization for testing, prioritization for anything so that we can do our job, we're pre-hospital. I mean, out of mere frustration, just to add a finer point, I mean, we were quarantining so many firefighters at the beginning that we actually said to folks in the federal government, we're going to run out of firefighters long before we run out of COVID, because we're locking them up for 14 days so that they don't get sick or they don't make someone else sick. Mm-hmm. Look, the fact of the matter is the Chief Ludwig is right. These folks don't get to the hospital in most cases by Lyft and Uber. They get there by us. We take them. And because of that, there needs to be that communication, that recognition. We need to be at the table. The fire service and EMS service, rescue, has to be at the table at the federal government to talk about these issues. At the beginning planning stages, right in the middle of the incident, and when we do a recap or we do an assessment afterwards, we have to be at that table.
Okay, so where are we 1 year later? What are you hearing from your members? Are you hearing that they are getting the gear that they need? They are getting the PPE that they need to respond safely to the calls? I'll start, Dave, I'll start with you.
Yes, the bill, they are getting the PPE. The problem is we don't know where they're getting it from. Because we don't know if they're getting it from the vendor that they're buying it from. We don't know if they're getting it from the federal government and it's being allotted to them. But we do know that they are getting, and the supplies are starting to flow, and have been flowing for a while. I mean, but we have an issue on the horizon with gloves, and we don't know what's going to happen in a couple of months, whether we're going to be the same thing with sterile gloves. And that's a problem for us. I mean, that's the protective barrier that we need. With respect to testing, it still takes too long for fire and EMS personnel to get their test results back. So we end up sometimes that those folks that aren't vaccinated is sidelining a lot of people for a period of time, which is causing tremendous, not chaos, but conflict at the local level between fire administrations and managers, because they don't know what to do. They don't know whether it's administrative leave, whether it's sick leave, whether it's vacation. They don't know how to bucket it because there hasn't been any type of diagnosis because we can't get the test results back. It takes 3 to 5 days to get the PCR test result back. So we are seeing some movement on the PPE front.
Tom, what about the volunteer service?
In most areas, I echo what Dave said, is they are getting the PPE they need. There was a lot of confusion at first between KN95 mask and N95 mask, but that has pretty much been resolved. There is starting to be some shortages of gloves for volunteer agencies, and I'm sure for career agencies. The one issue that's popped up in the supply chain is the inflation. In some cases, the cost of a box of gloves is up 400, 500%. Same with the cost of hand sanitizer and other things. What used to be a $2.99 bottle of hand sanitizer is now $40. So we're seeing some of that. The other issue with the supply chain is, no one has talked about the single points of failure that could cause everything to be broken again, even though they're talking about additional waves and the variants of the virus. One of the things that we would like to see with testing is not only the initial testing, we would like to see a broadening of the antibody testing being made available to first responders, so we can get a better assessment of the resiliency of America's volunteer fire service. There's also been no long-term talk or any long-term discussion about how taking what we've learned in the last 14 months and applying it to the future. How can we ensure that fire departments, both career and volunteer, are well prepared? As Dave also pointed out, when are we going to actually be made in writing a priority for issues like PPE, so we're not competing with the Krogers, the Walmarts, everywhere else? Those are some things at this stage in the game we need to be talking about.
Chief?
Yeah, a couple of different thoughts on this. One, I agree with Dave and Tom on a lot of issues there. I'll expand on a couple of those. Dave talked about and Tom talked about testing. And yes, when you're waiting 3 to 5 days and you're quarantining your firefighters and it turns out they're asymptomatic, you not only hit your budgets as a fire chief because of overtime, because we can't, if you're staffing 4 on an engine, you can't go down to 3. You still have to bring somebody in on overtime. So it's hitting our overtime budgets with the fact that testing's not as rapid as we would like. Now, I will tell you here where I'm at in the city of Champaign, about 2 hours south of Chicago, the University of Illinois is here, their main campus, and we are actually working with them. And every morning, my firefighters go and we do a spit test with them. And within 5 to 7 hours, they get an alert on their phone whether they're positive or not. And what's so cool about it is that we know if they're positive before they're actually contagious and before they're symptomatic. So we send them home. Whereas before I'm quarantining. At one point, my greatest was I had 30% of my workforce being quarantined because of exposures. And so the rapid testing in our case has worked out so well in the fact that we've identified those that are infected but not contagious or symptomatic yet, and get them out of the workplace. So the other part of that also is what Tom alluded to, and that is about if you look at the 4 phases of any disaster, we're still in the response, but we're morphing into recovery. And what are those lessons learned? And I think, one of the things that we need to talk about is how can we respond better, not only to this event in the future, but how we can respond better in the future, and how the federal government, as a partner with us, as a response mode, as a response agency, as a response partner, can work with us to make that response better in the future.
Throughout the pandemic, the Fire and Emergency Services national organizations have been advocating at the federal level to get funding into the hands of local fire and emergency services departments. Your organizations, working with CFSI and other organizations, have been successful in getting funding for the AFG and SAFER grants, included in the annual appropriations and in supplemental funding. in addition to those two programs, there's money for state and local governments. So my question is, how can fire departments work collaboratively with state and local partners to ensure that the funds awarded to state and local governments are equitably distributed? And when I mean equitably, I mean equitably provided to local fire departments as well. So Tom, I'll start with you on that one.
I think the key is going to be to make sure that there's an adequate risk-based assessment done across the nation to look at, impact. Certainly the urban areas and the major cities were hit hard, but rural America often lacks, even on the county level, resources to handle anything above a level 1 or level 2 incident. So we have to take a look at to make sure that issues on the volunteer side is to make sure that the strategic national stockpile is given the appropriate attention that it needs, so that it can really take a look at the 45,000 fire stations across the nation and make sure that there is enough in that stockpile to be able to sustain an operation. It's just like any other thing. Once you start an operation, you have to be able to sustain it effectively. We have to look at vaccine stockpiles. That's a whole other issue is, the vaccine availability in rural areas and the prioritization of that. They also have to take a look at that SAFER and AFG truly need to be funded at levels. $100 million does not go very far across 50 states in a competitive grant program. And, they're going to have to really look. If you remember when SAFER and AFG first came out, the first AFG, I believe, was at 750 million, and it's now down to 335 with the, add the 100 million in. That truly has to be looked at. A lot of career fire departments, and it's a career and volunteer issue, is retention and recruitment. You are going to have to commit resources to retention and recruitment through SAFER, and both career departments and volunteer departments need to be able to be given the resources and the tools, and there has to be some kind of incentive given to both career and volunteer to recruit and to retain people. They have to realize the role that the fire service, both fire and fire EMS based, play in a disaster response. It has to be recognized and it has to be truly funded. It's sad that more money is going overseas, not getting political, but more money is going overseas for some types of relief than is being spent on the first line of defense in the United States, the fire service. So on that, I think myself and Mr. Lang can agree there has to be a true commitment to bolstering and maintaining and sustaining levels of adequate funding in AFG and SAFER. And they have to also look at, issues like public health through USDHHS. We have to look at issues with regard, how are we going to truly classify viral threats and, a bio threat? Is it through, typically, the hazmat agencies, or is it going to be part of a separate DHS funding source? Because there's no questions on AFG about dealing with bio threats. It's about, your fire reports, your NIFRS reports. We may have to capture data on NIFRS reports and be more specific and getting, drilling down to get more granular data. But I think that, there has to be a broader commitment on a federal level.
Dave?
Bill, this is going to require the fire service to be really at the top of its game politically. You're in the American Rescue Plan, there was $360 billion appropriated for states and local governments. It's going to be placed into the hands of elected officials. Well, if we take, for example, the competitive nature of what we had to go through during the response, multiply that times 10, because to get a seat at the table to talk about where that money is going, it's going to be really, really difficult. So I would encourage fire departments to think about, fire and EMS departments to think about the things in which you really truly need. Not the wants, but the must-haves. And then get to the elected officials, from the governors to the mayors, the city council, the aldermen, to the elected officials that have control over these, and make your case. And the question you have to ask is, how do you expect us to respond? without the right resources. So as we're coming out of this, as we're coming out of this economy, this money is going to help. But if we don't make our voices heard politically at the table, we're not going to see the portion that we need to see. Now, look, we're a problem of that. I mean, think about the last time you saw a firefighter come down a ladder from the third floor window, probably a kid under each arm, rescue him, and the camera goes up and says, "Hey, you're a hero." "No, I was just doing my job." Well, you know what? Yes, we did our job. We did our job in the 50 states across this country. And because of that, we got hurt back home financially. And we need to have a seat at that table to talk about how that money is going to be distributed, how it's going to be paid.
Okay, Chief, the strength of AFG Safer, that's money that goes straight from the federal government to a local fire department. And that's why that program, those two programs have been so successful. But there are federal programs whereby the money goes from the feds to the states and to the local government. You're a chief at a local level. You have probably been the recipient of breadcrumbs in some of the departments where you serve. You know, what must we do? Do we need to change our message? Is that it? And if so, what should that message be? And why the challenge in getting, the state governments and even the local governments to recognize the role that we play and hence the funding we need to do the job, AFG Safer notwithstanding.
And you're right, Bill. I love how AFG and Safer is structured because it's a direct payment to that local fire department. And there's no middle person who's going to take their 10, 15, 20% administrative cut off the top. So, you're right. We get the dribbles when it does go through the middle person, and they do take their cuts for administrative cuts and their cost and other things like that. So there's a couple of things that come to mind. Is one, I like to say, make a friend before you need a friend. So we need to establish those relationships with those politicians and those decision makers in those state and local offices. So when that money does pass down, that at least we're trying to get a seat at the table. And the other thing that I've been trying to tell fire chiefs that we need to start changing this paradigm and this thinking of the decision makers is that we're not this hole where money goes into. There's this perception that the fire service is a hole where money goes into and they see no return on their investment. Whereas if they were to put broadband into a community, they see an economic return on their investment for that. If they build some type of community center, they might see some type of economic return on their investment as other businesses spring up around that. We got to change the paradigm and the thinking that we are also, the fire service also is a part of the economic engine of any community, because we are there to save property. We need to quit talking about how many losses we had last year in our annual report, and we need to start talking about how many saves of dollars we had in our annual report. We don't talk about we lost $9 million in property. We talk that we saved $45 million in property last year. We're part of the economic engine of any community, and so putting money into us is not this dark hole where they don't see the money anymore. It is actually a part of helping to grow the community by putting money into the fire service, and we need to start changing the thinking of our decision makers and our politicians along those lines.
So yeah, on COVID itself, I've been on your websites. In fact, I go to them frequently to find out, to learn more about how fire departments should be responding to COVID. So can each of you share the types of information that you have available on your websites that are geared towards the first responders?
Early on, even in January, before everything kind of exploded last March, but in January, we started putting on our website, we were monitoring the cases of coronavirus around the world through the Johns Hopkins database. And then in February, when I was president of the IFC, we actually implemented a COVID-19 task force, which there were many people on, including the IFF, members of the IFF. And as a result of that, we continue to push information out through that COVID-19 task force and put it on our website. We also distributed, email blasts and other information like that. but we actually had dashboards on our website that were tracking in real time information on the number of infected firefighters, the ones where there were PPE shortages, where there were cases of coronavirus around the United States. There was multitudes of different dashboards on there. Plus, we had all the best practices from WHO, the World Health Organization, and also the CDC, plus a plethora of other information on there that we're putting out, and information that we're learning about fake N95s and fake PPE. There's just a ton of information on there, many that still remains on the IAFC's website.
The very beginning of the incident, we found that there was a lack of proper information. The CDC wasn't able to keep up. Everything from the initial dispatch call taking information of persons under investigation. They were asking them if you traveled outside the country, when they should have been asking them, have you got a fever, have you got a cold, so they could give us the right information. We were rolling up blind at the very beginning of this. So we were forced out of pure necessity to work with doctors and professionals to actually draw up protocols and to put them on our website. And our website has grown. It has grown astronomically with respect to information. When the CDC came out and said that we could wear bandanas instead of N95 masks, I mean, how we gave information when there were counterfeit products out there, and we were seeing, because of the commercialized response, and we're seeing counterfeit N95s, how to tell the difference. We had documentation on that website. And then behind the membership wall, we did a very deep dive in the economy and what happens when you shut the economy down. Looking at this problem, not only from the liability side, which is the expense side for fire apparatus and firefighters, but also from the asset side. Where's the revenue going to come from? And what's Mr. and Mrs. Smith on Main Street going to go through? So we could effectively give our leadership the right information to make the decisions, how to respond, how to protect themselves, but then how to be equal and active partners at the table with the decision makers.
I mirrored a lot of what the IAFC and the IAF did, but one of the big issues that we found early on was the amount of conflicting information coming out of two different federal agencies, especially with regard to PPE, infection rates, other things like that. So we wanted to make sure the information we put out was accurate, had been vetted, and would be sustainable over time. We also started tracking, as Dave did with the IAFF, both expenditures and income. We developed tracking to show how much, because volunteer fire departments rely heavily on fundraising, that was basically shut down for the most part across the country, which potentially put the volunteer fire service in a crippling position. We worked with legislative partners to find out what was moving where. And we had a lot of initial hopes with regard to the payroll protection plan that was coming out, but then a lot of volunteer fire departments, due to problems within that program, which have been well publicized, they weren't eligible or weren't allowed to file for loan applications to maintain their operations. So we followed and tracked that. We also made it a priority on our Volunteer Voices, which is a forum on the NVFC's website, to solicit and find out what was going on across the country. And in March of last year, we formed our pandemic task group, which has representatives from across the country, from the Northeast, the Midwest, the South, the Northwest. And we wanted to really get hands-on, accurate data. And we've been sharing data across through our Homeland Security Committee, through our Pandemic Task Group Committee, through our Health, Safety, and Training Committees, to volunteer fire departments, and pushing it out, in addition to our webpage. When they started coming up with the vaccines in November and December, we immediately started a project with PHMSA, the Pipeline Hazardous Materials Safety Administration, to make sure that our members were aware of the safe transport of these vaccines, which had to be stored at super cool temperatures. That was an issue. There was a couple incidents across the country where the driver of a vaccine transport vehicle was asphyxiated because they were using dry ice to cool the vaccine. So we came up with some safety protocols for vaccine distribution sites. We developed some guidance on setting up remote vaccine sites in areas where you don't have the typical resources, ad hoc what are called points of distribution. We pushed out a lot of information about CPODs, controlled points of distribution. So I think there was a lot of information pushed out, and I know to this day ours is still being updated, and information is added as it becomes available.
Okay, moving on to the topic of the vaccination. Now that we have a working vaccine, can you talk about the role of the fire departments are playing in administering the vaccination? What more must be done to support the fire departments in their role of distributing the vaccine? So, Gary, I'll start with you.
Yeah, good question, Bill. One of the things that while I was president, I had the honor of testifying in front of the CDC, their immunization practice committee, and once in front of the National Academy of Sciences. There are three different times I testified, and each time I stressed that as we were trying to prioritize firefighters and make sure they were in the priority for a vaccine, but during that I also stressed that we are a ready response force that are strategically and geographically distributed, that we can help with the administration of this vaccine. And unfortunately, it looked like early on there was no plan. They were just giving the vaccine to the states, and the states were trying to come up with their own plans when we were a ready response force. Now we see the fire service stepping into many communities, and they were actually a part of the delivery care system for the vaccine. So it's working out well, but these are lessons that we can learn going back into, as we talk about in the recovery phase, for when this ever happens again, that we are a ready response force that's capable of delivering this vaccine. In fact, many stations, many departments have drive-through stations. People wouldn't even have to get out of their cars. So it's so important, again, that we're part of any response in any community. It doesn't always have to be a 911 response, but we're ready to go. That funding for that then would also come directly back to those fire departments also. I know of a lot of firefighters I talk to around the country, they're actually making overtime because it's being subsidized by the federal government, the way the vaccines are being done. But again, it's being done through the local health agency.
Tom?
The role that volunteer fire departments are playing across the country varies from state to state. In many states, EMTs and paramedics are allowed to administer the vaccine. In other states, they're not allowed to because of state health authority rules. Many volunteer fire departments are participating in the establishment, the operations and management roles, like under the incident command system, for control points of distribution, for drive-in testing and vaccination clinics. Volunteer fire departments, because they're a centralized part of it, most small and rural communities are often being used as the testing or the vaccination site. So volunteer fire departments are playing a huge role in rural communities. We've gotten a lot of input from Alabama, Mississippi, Iowa, Nebraska, Washington State. An interesting component too is volunteer fire departments are playing a huge role in tribal communities in the Southwest and in the upper Midwest, on different tribal nations which rely heavily on volunteer fire departments. They're becoming the public health authority. They're also using fire apparatus and ambulances and squad vehicles to go out and travel to remote areas and access people who may not have transportation to a testing or a vaccination site. And because of their core role in the community, volunteer fire departments are being relied on heavily in many parts of the country.
Dave?
This question takes us right back where we started, and that is the federal government needs to recognize our capabilities and our capacities. They have to recognize that we are part of the public health system, that we are part of the pre-hospital system, that when they hear the siren, they see the fire engine, the ladder company, they see the rescue, you got to understand that there are highly qualified, trained firefighters in there, and paramedics, and intermediates. And they have the capacity and capability of doing this. We started to really inform the federal government and the different agencies of those capacities and capabilities. And then we began to see more and more, and we continue to see more and more involvement in our local communities where they're accessing firefighter paramedics, firefighter EMTs to come in and assist. And actually, inoculate. When I got my second shot, it was at a park and ride in New Hampshire. in which there were 3 lines of traffic, which the National Guard was running the kind of the security and control. And then there were firefighters in bunker gear on this early Saturday morning with wheeled carts with the vaccination and the PPE they needed, going from car to car like a drive-through, putting needles in people's arms. And every single one of them was a firefighter in all 3 lanes. And they vaccinated thousands of people that day. But there again, it's an understanding of what we do, the capacities and capabilities of what we have to offer. Look, when scientists don't know what to do with it, and experts don't know what to do with it, they call us and we always deal with it. The fire service, we just don't leave it. We don't leave buildings burning. We don't leave people on the side of the road. We take care of it, no matter what it is. And in this case here, where it takes the federal government days and weeks to really mobilize, we're there in 2 to 3 minutes. And we're there to, to provide a quality service. And I think that if we can do one thing better, that is making sure the federal government understands our capabilities and our capacities. Now, one last thought with respect to that. We're seeing kind of the tale of 2 responses. The very first part of this emergency, we saw this thing that they kept saying time and time again, the administration and the federal government. And that is, this is locally responded to, state managed, and federally supported. We're not hearing that anymore. What we're hearing is we're federally supporting our states and our local communities to be able to do their job and to respond. So what we've seen is we've seen that commercialization response switch to that humanitarian response that we really needed to see. And that's why we're seeing hundreds of million people, or over 100 million people already been vaccinated. That's why we're seeing supply chains starting to come up, and we're starting to see manufacturers starting to open up. That's why we're starting to see money coming in and starting to flow into the local communities, because we're seeing that dynamic change right before our very eyes, which is going to get us to herd immunity faster. But we can't stop there. We got to figure out what went wrong. Now we have to plan for the next event.
Last question, but before I ask that question, I just want to make my own little closing comment. And that is to thank each of you. In your responses, you'd often refer to the IFF, the IFC, the NBFC, each one of you. And I think that sends an important message to the fire service, how the organizations are working together, not only on this issue, but on a myriad of other issues that are being addressed up on Capitol Hill. The fire organizations do work together, and I think that's to a large extent why Congress is willing to listen to us. And so, again, I credit your organizations and the other organizations, again, for looking at those issues where we can speak in one loud voice so we can get our message through. And I think we're getting our message through with respect to COVID, but we do have a ways to go. There's no question about that. So put yourself in that committee hearing room. You got that tent card with your name on it. And you're asked by the chair of the Homeland Security Committee or another committee of jurisdiction, moving forward, what can the federal government do better to make sure that our firefighters and our emergency personnel have the equipment, the training, and the funding they need to address this pandemic as we move forward? Because I think, as one of you said, there might be a second wave. There might be a third wave. We might need booster shots. This thing's not going away anytime soon. So what message would you send to Capitol Hill in terms of what our needs are moving forward? So Dave, I'm going to start with you on that. I'll work down to Tom, and then Chief Ledwig, you can bring it all home.
I think first of all is we need a very in-depth look at what happened. In order to be able to deal with the future, we have to know what happened in the past. We do this on every single emergency call we go on. What did we do right? What did we do wrong? What did we know? But more importantly, what did we not know? And I think the federal government should be asking the fire service to come to the table, recognize us in the pre-hospital setting, recognize us as part of public health, recognize that we shouldn't be spread all out over the buildings of Washington, D.C., but we should have a central location, and that we should have a voice, whether it's in Health and Human Services, whether it's in the Department of Transportation, whether it's in Homeland Security or FEMA. that our voice counts because we're the ones on the ground. We're there within 2 minutes, 2 to 4 minutes of any incident. We're on every street corner. We have firefighters that live in every congressional district. We are the nation's first responder, their first line of defense, whether it comes to a wildfire, tornado, or hurricane, or a pandemic. And the federal government should really put us at the table because at the end of the day, it's not, we need resources, but we have a lot more to add to this discussion and will help make this next emergency go a little smoother.
Tom?
100% what Dave said. We need to do an in-depth post-incident analysis of this and look at how each constituency played a part in it. We need to stop thinking about the if, it's the when. And we need to make sure that the steps are taken and the resources are allocated so that we are prepared for the when. It is not an if. You know, we had the Spanish flu in 1917, 1918. We had other pandemics. We had the avian flu scares. You know, there was the mad cow disease scares in the Northeast. It's not if, it's when. And like Dave said, we have to be involved in the planning. We know what our capabilities are. We know our role. We're not trying to step outside our boundaries, but we need to make sure that we have the resources and we don't allow this apathy that has came in since, in the past 20 years, the pendulum slowly swung back to we become an afterthought until we're needed. And then it swings back over here. And by that time, it's too late. We have to truly, if we're going to have to operate our incidents by NIMS and by, the National Response Framework, that framework has to be solid. The studs have to be in the walls. We have to have a solid foundation. It can't be something that we try and cobble together once the pandemic or the other national emergency starts. And we have to have that seat at the table.
Chief?
Just a couple of thoughts, Bill. One, before I answer, I want to echo, you're absolutely right about all our organizations working together. I can't tell you how it did my heart good when I saw a lot of the letters during the pandemic that went to the Capitol Hill, went to the White House, they went to different federal agencies such as FEMA, and there was 4 logos at the top of that. There was the IFC, the IFF, the MVFC, and then also the Congressional Fire Service Institute logo. To see all those logos on the same letterhead going to decision makers, that actually did my heart very good to see that. So I echo your comments on that. I'm also going to side with Dave here a little bit too. When we look at law enforcement, they got a cabinet position. They got somebody at the Attorney General sits in the cabinet of the president, and they got a spokesperson right there who can argue and can champion and advocate for their causes for law enforcement. And we really don't have that. We're buried somewhere down deep. The United States Fire Administration, although they do a great job, they're buried down deep within the Homeland Security offices. The EMS agency, although they do a good job, they're buried deep down into the the Department of Transportation through NHTSA. So we need a voice at the table. As they say, if you're not at the table, you might be the lunch. So we need to have a voice at the table. We need to have someone who's going to champion, someone who's going to advocate our causes. And as a result of that, we need that person to also advocate and tell them, hey, we're not the first responders, we're the last responders. Because after you call 911, there ain't nobody else to call besides us. So we have to be properly funded, and we have to have proper staffing. We have to have the right equipment. We have everything that we need to respond, because after us, there is no one else to call. So I strongly support that we have to have somebody at a higher level that is a champion and advocate for our causes.
Gentlemen, that concludes our session. I thank you very much. It was certainly a learning experience for me, and I know it's been a learning experience for the folks who are listening in. And on behalf of CFSI, we thank you for the leadership you're providing for your organizations and for the fire service as a whole. And hopefully we can reconvene this panel somewhere down the road and we can talk about the progress that is being made to benefit our firefighters, our emergency services personnel, and the American public at large. So again, on behalf of CFSI, I extend my thanks and gratitude for your participation in today's panel discussion.